Hi everyone. I want you to picture this for a second. A patient is in the ICU, hooked up to monitors, oxygen, maybe even a ventilator. They're too weak or unstable to move, but doctors still need an x-ray. Fast. So how do we image them without putting them at risk? That's where mobile radiography comes in. Mobile radiography is when radiologic technologists bring a portable x-ray machine directly to the patient's bedside instead of bringing the patient to the imaging department. This type of imaging is commonly used in intensive care units, emergency rooms, trauma settings, and even nursing homes. One of the biggest reasons mobile radiography is important is patient safety. Many patients who need imaging are critically ill. Moving them could worsen injuries, disconnect medical equipment, or cause severe pain. By performing images at the bedside, technologists can get the images physicians need while keeping the patient stable. Another key point is the equipment used. Mobile x-ray machines are battery powered and mounted on wheels, which allows technologists to move them room to room. The most common exam performed portably is a chest x-ray. These exams help diagnose conditions like pneumonia, heart enlargement, lung infections, and complications from surgery. However, performing x-rays outside of a shielded radiology room introduces radiation safety concerns. Technologists must wear lead aprons, use shielding when available, and maintain distance during exposures to follow ALARA principles, which means keeping radiation as low as reasonably achievable. Infection control is also critical. Mobile radiography requires strict cleaning protocols and personal protective equipment, especially when imaging patients and installation. This protects both healthcare workers and other patients from the spread of disease. Finally, mobile radiography presents unique challenges. Technologies often work in crowded rooms filled with IV lines, monitors, and life support equipment. Positioning patients properly can be difficult, and image quality may not always match images taken in a radiology department. Even so, technologists must still produce diagnostic images doctors rely on. To summarize, mobile radiography allows imaging to be performed at the patient's bedside, protects critically ill patients from unnecessary movement, uses specialized portable equipment, and requires strong radiation safety and infection control practices despite environmental challenges. Overall, mobile radiography plays a vital role in healthcare by making diagnostic imaging accessible to even the most fragile patients. Thank you.